you for joining us. This is Mature Living, the show for seniors, by seniors, and we're always bringing you information that's going to be helpful to families and people of all ages, actually. I'm Mary Yanez, the director of the Senior Adult Program, and we have a wonderful interview coming up right now. We're going to talk about May, which is Stroke Month, and we want to bring awareness. And the Hospitals of Providence is doing a walk during the month of May. They're going to talk to us about how to prevent strokes, what are the signs and symptoms, and so we've invited a couple of their employees. We have Cristina Ramirez, who is an RN or a nurse, and you're the stroke coordinator at Hospitals of Providence. And of course, you brought Jackie Lopez with you. You're a speech therapist, and that's very important. Let's begin our conversation and talk about what is a stroke.
A stroke is a blockage or a rupture of your vessels in your brain.
Yes.
So what happens is that if you get blocked or a rupture, oxygen and nutrients just do not supply your brain, and that is a stroke.
Yes, and it causes some great damage, doesn't it, for people? So what are the risks of having a stroke?
So everybody's at risk of having a stroke. You have to know your risk factors, very, very important. We have risk factors that we cannot change. Those risk factors are our age. We cannot change our age. We cannot change our ethnicity. And then you have those that you can change, that you can do something about. For example, if you have high blood pressure, which is a major cause of a stroke, you can change that by going to your doctor, taking your medication. Also high blood cholesterol, obesity. If you are a smoker, if you consume alcohol, if you do not exercise. So we can change those by going to your doctor annually, taking your medication the way you're supposed to, and trying to exercise and eat healthy. Very, very important, because you have to remember strokes, 80% of them are preventable. And so if they're preventable, it's all about modifying those risk factors, but you need to know what those are.
And one of the things that I love about the Hospitals of Providence is that you all are great community partners. You're out there in front of the community giving presentations. You've brought some beautiful posters that we're going to show about FAST, which is something I'm going to learn. And so, Jackie, tell us a little bit about the signs and symptoms of a stroke.
So we asked the community to use the American Heart Association FAST acronym.
Oh.
So F stands for face. So you would observe the person and you would ask them to smile and see if one side of the face is drooping.
Yeah.
Or when they smile, it doesn't look symmetrical.
Mm-hmm.
A stands for arms. So you would ask them to raise both arms and you would try to notice if one arm is drifting downward.
Ah.
S stands for speech. Is their speech slurred? Do they have difficulty understanding or difficulty expressing themselves? And T is just to encourage everyone that it's time to call 911 immediately.
Yes.
Some of the other risk factors is just a sudden severe headache, and the key word is sudden. We get headaches, but they're onsets and they start to get progressively worse. But a sudden severe headache, sudden difficulty walking, sudden difficulty with balance or confusion, those can all be signs of a stroke, and we encourage everybody to just call 911 immediately. Immediately.
Even if it's a false alarm.
Right.
I mean, who cares, right?
We would rather a false alarm.
Yes. Maybe it's something else,
Right.
that's going on.
Exactly.
So many things where it's got stress,
Exactly.
things like that. As a speech therapist, you work with stroke victims, I guess you could say. I guess maybe they're not victims,
Yes, ma'am.
cases.
With stroke survivors.
Are they victims?
They're survivors.
They're survivors.
Yes, we
Right.
do.
Stroke
Yes.
survivors.
Yes,
I like
ma'am.
that.
Yes.
Yes, I'm very blessed to work with stroke survivors and to be part of the rehabilitation process. So I work side by side with physical therapists and occupational therapists and nurses and rehabilitation doctors who focus on getting the patient back to their previous abilities.
State of abilities. And one of the things that I think about is that it's silent. It could come at any moment, and it's so debilitating because sometimes you have to learn to walk, talk, and eat, and do everything all over again. But I've seen some tremendous successes, and I know the nurses and the therapists are very I guess you can get credit for that.
And the
getting
key
that.
is to recognize the symptoms and identify them and get help fast.
Yes.
Because rehab or disability is, well, stroke is the leading cause of disability in the United States, and it's long term. And we want to, our goal is to minimize those disabilities by telling you about the, symptoms so you can act fast. We want
Very
you to
good.
act
Very
fast.
good. Are there different types of strokes and treatments, or actually stroke treatment?
Yes, there are. There are different types of strokes. You have the ischemic stroke, which is blocks blood from getting to your brain with a clot, or you have your hemorrhagic stroke, which is the rupture, and it can be caused by an aneurysm or a cluster of vessels that just get too weak and they burst. We have treatments for all that. It is very time sensitive. We have an IV medication that they can give you to break down the clot. It's called Activase, and we can only give that to you up to 4.5 hours of the time you were normal.
Yes.
The next one is we can take you to surgery and get that clot out of that large vessel. However, it is time sensitive. We have up to 6 hours to get that out. So that's why we ask the community to please come right away.
Great. Well, thank you for being with us,
Thank you
ladies.
so much
Thank
for
you for
having
inviting
us.
us.
We
Thank
hope
you.
the community turns out,
We
because it's
appreciate
really
it.
important.
Yes.
We've got to stay healthy.
Right.
Yes,
Thank
thank you.
Okay, we'll be back with more Mature Living guests. Thank you for staying with us. We want to continue our conversation on mature living to talk about some important things that helps families. Many of us have seniors or young people that need home care. And as we decide to choose who we want to bring into our homes to take care of our elders or those people that need care, we think about the many, many organizations. One of them is here, Saffa Home Care, and they're here to talk to us about their services, about the importance of home care, and even how to choose. Charlie Ramirez is here. You're a consultant with Saffa.
Yes, I am.
You're also with Urgent Care.
Right, I'm Director of Public Relations with Urgent Care Home Health.
And Maggie Escobedo is the Public Relations, supervisor or manager for Saffa, right?
Correct.
Okay, tell me a little bit about home care and how people qualify. How do we choose the right organization?
You know what, choosing is a privilege that we have, okay, that we're allowed to be able to choose. And by law, we can choose whoever we want to be able to take care of us. There's a lot of agencies you can choose from, but you got to choose the ones that stand out,
Yes.
that are doing it for the right reason and not for the wrong reason, okay? Our agency that, of course, was Urgent Care Home Health got started over 10 years ago by the owner who came from Africa, and he came with the idea of wanting to help people continuously over here, and this was the best way to do it.
Yes.
He's actually a doctor in his native country, and in being a doctor over there, he did a lot of foundations over there, a lot of services for the needy, for the low income. So he continued that here by developing a home health agency.
That's wonderful. And so, qualifying, who qualifies?
Qualification has to do a lot with if a person is considered to be homebound. Now that's something that is confusing for a lot of people, because a lot of agencies will say that being homebound means that you're not able to go out, and that's not the case. Homebound means, okay, that you are restricted and you have limited capabilities of movement. It doesn't mean that you can't get in your car and go to church, or be able to get in your car and go buy groceries, because that's part of fundamentally, everyday living.
Yes.
As somebody that has a problem with themselves, it can be even high blood pressure that causes them to get dizzy, medication that is they're not adapted to. They've got maybe problems in being able to balance themselves while they're walking.
Okay.
They can have problems also as far as cancer. They can have problems as far as that they need IV, that they have something that's continuously hampering their day-to-day living capability.
So how do we start? How do they start the process? How does a family begin to consider when they have someone with those kinds of issues, start the process?
The process starts with their own primary care physician.
Okay.
That cannot be started from, it can also start from the hospital. Actually, a hospital can be able to send a referral to be able to give us the opportunity to give them home health care.
Okay.
But the doctor has to send us a referral. Without that order from the doctor, okay, then we cannot do anything at all.
Okay. I wanted to ask Maggie about, and then we'll get back to family support, that's really important, but what are the kinds of services that Saffa provides for your clients and also the staff?
We provide our services, which is a big help for the patient.
Yes.
We have home health. We have certified nurses, registered nurses, and also LBs. We provide help at the house with the patient. We educate the family so they can make the life easy for them. We provide physical therapy, occupational therapy.
We provide even IV therapy. A lot of agencies, okay, cannot do IV therapy at home. We have that privilege of being able to do it in the comfort of their homes. It does start with initially being started at the hospital, because usually when they have IV therapy, that starts at the hospital.
Yes.
So the first application starts there, but then we continue applying the IV therapy at home. And in order for you to do that, you have to have a licensed nurse capable of doing IV therapy.
Wow, that's interesting. And talking about family, sometimes the senior, the patient is sent home and the family has to do some of these procedures. And what about family support? Are we providing there? Are there difficulties sometimes for families to help?
You know, unfortunately, the most important thing in anybody that has an illness, okay, is that they have the support of the family. And here in our culture, okay, you would think that that's the case. But unfortunately, a lot of times we come across situations where the family is either too busy doing things that they think that are more important than taking care of their loved ones that are sick, or just that they don't want to deal with it because of their lack of knowledge regarding the medical field. And it's not so much being experts in the medical field, it's just wanting to learn the basics, okay, to be able to do them themselves at the comfort of their home.
Yes, and sometimes they're working and supporting their family, their sons, daughters, or you know, and it's hard to keep up with all the kids and then grandma and grandpa and or tia and tío, you know.
Right.
So it's very, very difficult. So this is where you all come
Yes.
in.
You know, a lot of times, okay, when we find ourselves that we go to their homes, first of all, allowing us to be able to go into their privacy, because the home is their private life. So they allow us to do that, and a lot of times we find ourselves that they look at us as being the family because we are there taking care of them.
Exactly.
And they are able to trust us, and that's one thing that's very important. Get that trust to be able to allow us to be able to go in there and take care of them because they need that.
Yes. Do you cover pretty much the city?
Yes.
City and county, how does that work?
Yes, we cover Horizon, Socorro, El Paso, of course, Canutillo, Sunland.
And if someone wants to get a hold of you, where can they call and where are you located?
The name is Saffa Home Care. We're located in 1717 Brown Street, Suite 2. Our phone number is 915-440-4100.
And just lastly, a success story of a family you've helped or someone that is just so pleased with your services, you know.
Well, you know what, okay, there's a funny story in regarding to the misconception that patients have, okay. We had one situation where we got a referral, and we were trying to contact the patient so we could be able to set up an appointment to go see them. The family members there said, you know what, he's not here, he left. I said, what do you mean he left? So we contacted the doctor, we contacted other family members. Nobody knew where the patient had gone to. Finally, I was able to get a hold of them because I went to their house. If we can't find somebody through the phone or through contacts, we'll go to their home because it's important to follow up.
Yes.
So come to realize that he was going somewhere else to live with a friend because he was afraid that we were going to go in and take away his Social Security. That's the misconception that there is. It's like I tell them, you know what, that does not happen. We are not a nursing home. We are nurses at home, which is a huge difference. And we have nothing to do with Social Security. This is a privilege that they have. This is a benefit that they're paying for, that they have been paying for all their life in paying their insurance. And it's a benefit that they deserve. And a lot of times they don't realize, okay, that it's there for them and no cost.
And so don't hesitate to talk to your doctor about assistance at home.
No.
Correct.
Home
No.
care.
Right.
Very good. Well, thank you for being with us. That time flies here
Yes.
at Mature Living, doesn't
Right.
it? And thank you for being with us, and come back again. And we'll connect you with other community events that
Please.
are going on,
Thank
so
you.
we can continue to educate our families and our seniors. Thank you.
Thank you so much. for
Okay,
the
we'll be back
opportunity.
with another guest. Well, thank you for staying with us, and you're going to get some great information about assisting veterans in this community. And I think we're like dreamers. We think of an idea, of philosophy, how we can help veterans. And I'm going to introduce you to a couple of fellas here that have dreamed, and they've got objectives, and they've got a plan. And this is to develop the Veterans Village Project. And Carlos Rivera's here. Thank you for being with us, Carlos. You've been kind of like the spearhead person. We'll get you to introduce yourself in a minute. And then, of course, Fernie Bermudez, who is very involved with the Vietnam veterans.
Good morning. My name is Fernie Bermudez. I am president of the El Paso County Vietnam Veterans Memorial, which was established. We're going on a 1-year anniversary right now.
Oh, yes.
It is located at the Flags Across America.
Very good, very good. And you'll be sharing some more information. And what is your role, of course? You're very active in the community with veterans.
Well, Mary, I'm currently the commander of the American GF Forum Paso del Norte chapter here in El Paso. Also president of Legacy of Valor, which is the nonprofit 501c3 organization that's kind of spearheading this Veterans Village project.
Yes.
But I also served recently as the national vice commander for the American GF Forum.
Right.
So we've been involved in veterans issues for like over 10 years consecutively now.
Yes. And boy, and are you building something that is going to happen, and you're going to have an open house. We're going to talk about that.
Right.
Tell me a little bit about the project.
One of the things that I've seen, I went on a nationwide cross-country kind of a fact-finding mission,
Yes.
meeting with veterans organizations across the country, and identified the key issues of interest to veterans. And they included, one, VA benefits, health care, jobs, starting small businesses, starting nonprofits, and of course, developing a small business incubator to help veterans start businesses. And of course, to help our homeless veterans, because no veteran that has served honorably in this country should be without a home.
Exactly. And the services that are going to be provided through your project, tell me a little bit about that, Fernie.
Basically, what we're trying to do is open up a facility where a veteran can come in. We can provide him with several different objectives. In other words, to empower them mostly, because there was a need for it. There is a need for it because just like our memorial that we just finished a year ago, there has never been anything like it. And it's amazing the way the city itself, the county, they all took it in, and it was, so we're using that as a icon, like a healing wall.
Yes.
And we don't normally call it a healing wall, but it's actually a healing memorial. Yes. And we kind of went into that situation because we got a great attendance of people that came in and sponsor us and donated money and everything so that we can continue our work. We were kind of like dreamers, and also we were looking at some veterans that don't have any services and so forth. So basically we're like job development.
Yeah.
We're partnering up with different corporations for them to entitle us with the job opportunities.
Yes.
And one of the proudest one is, of course, St. Vicente Clinic. They're partnering up with us so that they can provide health services for the veterans.
Very good.
And also, the other one is El Paso Community College. Through their education programs, we can direct some of our veterans towards, and foreseeing in their education. Although we have a lot of different projects going on, and those are the three most important ones for right now.
I wanted to ask also, what about the, you said homeless.
Right.
Tell me about the tiny homes and that concept.
Let me just backtrack a little bit
Yeah.
to touch on something that Fernie mentioned. Last year, actually starting in 2015, Legacy of Valor partnered with El Paso Vietnam Veterans Memorial. And that's where we came up with the idea of working with a group of 8 veterans and family to develop the Vietnam Veterans Memorial. And with that monument, we honored our veterans that were killed in action or did not return from Vietnam. Once we completed that, I said, okay, now that we've done that, now we need to honor the legacy of our veterans that did come back.
Yeah.
And that's where the Veterans Village concept comes in. And I said, I'd like to highlight 2 of our main partners who are really our hosts for the Veterans Village, and that's Modesto A. Gomez Incorporated, which is a nonprofit organization started up to honor Modesto A. Gomez, a World War II veteran.
Yes.
And he's the grandfather of Mary Martinez, who's the owner of Home Watch Caregivers. So those are 2 of our key partners, along with Legacy of Valor and Vietnam Veterans
Very good.
Memorial. But let me touch on the tiny homes that you're asking
Yes.
about. What we're looking at is we have an opportunity with this agreement in partnership with Modesto A. Gomez and Home Watch Caregivers. There's enough space that we can develop tiny homes for homeless veterans.
Okay.
And we understand that homeless veterans are transient. You know, they don't always stay in one place at one time. So we're working on a concept to build small tiny homes for homeless veterans. And we're looking to create jobs by doing that, because we'll look to hire veterans to help us build the tiny homes. And hopefully we'll include the homeless veterans there as well.
Very good. I know you're going to need a lot of volunteers, and we want to give a contact number. Once you get it going, there's going to be an open house. Tell me about that and the address and the whole bit.
Yes, we have an open house scheduled for Saturday, May 27th at 4 p.m. at 8064 Alameda here in El Paso, Texas. That's the headquarters for this entire operation.
Yes.
And we have enough space that we can develop a program and develop the tiny homes, and also develop a small business incubator to help veterans with that.
And Fernie, you're going to need volunteers of all types.
Most
What is it that
definitely.
you're wanting to recruit?
Right now, we're basically cleaning up the place. We're painting and so forth, and we've had several veterans that had come in and helped us out. But this Veterans Village is, the main thing about it is vets helping vets.
Yes,
And
very
not
good.
necessarily is it just open for the veterans, it's going to be public also, because we want to induce and we want to make sure that everybody that we can take care of is taken care of. So we're going to have a great need for volunteers.
Okay.
We're also planning on opening up a museum within our confines there at the building. Plus, in the future, possibly have a little coffee shop where veterans can come in and relax and so forth.
Okay.
We got a great future, but we do need people to encourage us, and we're looking for sponsors also.
And you know what comes to mind is that the U.S. also has a tremendous concept
Right.
and philosophy, and they do it for the active
Right.
soldiers. We need to do something like that for the veterans.
And I love that concept because it fits right in with where we're going with the Veterans Village. And I'd like to highlight a couple of things.
Yes.
One, the Cub Scouts have been very active in helping us in the cleanup process of the property, so we want to thank them. We're looking for volunteers that have background in helping veterans with VA benefits, veterans that have experience in healthcare, veterans that have experience developing jobs, veterans that have their own businesses that can mentor other veterans starting small business, veterans in the nonprofit community, because there's nonprofits that we can create to help veterans as well. And of course, veterans that have worked with homeless veterans.
Wow.
So we're looking for veterans and family members and the general public to join us in this venture.
So where can they call? Because we're ready to volunteer.
All right. Yes, they can call us at 915-255-8877. And again, the address for this Veterans Village is 8064 Alameda, El Paso, Texas, 79915.
And it's right across the San Vicente.
right
Right.
across from
The
San
clinic.
Vicente Family Health Center. And what I'd like to mention is that we made our presentations to Centro San Vicente Board, and they've already sent us a letter agreeing to work with us, because one of the things I look forward to in the healthcare initiative is that if a veteran needs healthcare right on the spot, we don't have to take them all the way out to the Northeast. We can treat them right there, right across the street.
Wow, this is so much information to give in such a short time interview, right?
Yes,
Right.
it is.
But we're going to get it going.
No,
We're gonna
yes,
get it
we
going.
are. Yes,
and
we
thank
are.
you for being with us. And thank you for watching Mature Living. I hope you've gotten a lot out of this program.
Yes.
Thank you. Come
God
back
bless.
again.
Mary.
God
Sure
bless
will.
all of you.
Yes. And we'll see you all next week. Hello, I'm Mary Yanez, Director of the Senior Adult Program at the El Paso Community College. And I want to invite you to look at the continuing education class schedule, look for the Senior Adult Program, and see all the classes that we offer free for seniors 55 years and older. And so we invite you to call 831-7801 for more information and find out about the classes in China painting, drawing, we have acrylics, we have creative writing, we have so many classes, yoga, Tai Chi, so many classes that you can enjoy and meet new friends in our classes. And also keep you busy, stay engaged in community, and continue learning. Remember, knowledge is ageless.